Frankie Valvasori, and I work for an organisation called WASHUA, and I'm the Drug Counsellor and Treatment Referral Officer there, and also coordinate the health team at WASUA. Okay. Yeah, WASUA stands for the West Australian Substance Users Association. It's a name which shocks a lot of people sometimes. We're actually a peer agency, which means that we are composed of people who have been former drug users, are current drug users, or are being very heavily involved in the scene of drug users, whether it's family or friends. So we have a peer perspective, and we work very close to the grassroots and the communities of drug users, and that's our focus, to work with that community. Well, it was a bit of a long journey actually. I started off in science, and I used to work in laboratories, and I spent about 10 years working in laboratories, and the work was very interesting, but it was very, very cold. It just left me untouched. And then when I left work to have children, I decided to go and volunteer with youth agencies, and I worked on the street for about 10 years, and I just loved the work. I just loved working with people, especially young people, with energy and vitality. And I just, grew into that area. Obviously alcohol and drugs and mental health were huge areas for this group of people, and so I became involved. Yeah, and that's what sort of led me into that area. It was just working from the street, identifying problems, and then later on gaining employment and education in that area. So I didn't go from the top down, I went from the bottom up. Yeah, and that's what's attracted me into that area. I suppose part of it is, what has also attracted me is that I come from a family environment of intense alcohol abuse, drug abuse, and mental health problems. So it's like returning to your roots, like it's the environment I grew up in, the environment I know. So I suppose, there's, when you gravitate to work in that area, especially when you come from that area, you have an understanding of the suffering people go through. Not only their suffering, but their joys as well, and the problems involved and the impact it has on people's lives. And I suppose it's just a knowledge base that you know and that you feel comfortable in, and feel that you may be able to contribute to helping others manage. Yep, that's just basically why I work in that area. And if what I achieve is just more about just helping people to take control of their lives, to move from dysfunctionality to functionality, whether that involves use of drugs or not use of drugs. Abstinence is not necessarily the question, it's about harmony in your life, control of your life, choice in your life. And so most of my services are geared around just informing people, educating people, and giving people treatment where they're required, so that they can move on and to have a life that they choose to live. It's not about my choice, it's about their choice. Yeah. Some of the challenges, I think one of the largest things is stress and burnout, because you're dealing with very complex problems. It's not just the AOD, but it's also dysfunctionality and mental health issues. It's a very complex group of people, because the drug and alcohol use has either exacerbated beginning mental health problems, or developed, or it's come in the train of their alcohol and drug use. And then it's a lifestyle issue for many people. They might have no housing, they've lost educational opportunities, relationship breakdowns, physical health problems. So you're dealing with a very multi-layered sort of client who has many issues. And I suppose that's something that WASHUA, and I suppose many other of the alcohol and drug agencies offer, is we try to work holistically with our clients and really look at what their problems are, and if we can't address the issue, at least give them supported referral onto other agencies. So there's a lot of case management, holding clients where services perhaps can't address the issues initially, or there's multi-layered problems and you have to walk through certain layers of problems. A problem for this group of clients is often that they can't get early treatment, or that they are so complex that they don't exactly fit. If you're just an AOD client, you might just fit into rehab, but if you've got contributing mental health problems, it makes it more complex. And you mightn't fit into any system neatly, so it becomes very multi-layered with the client. So that brings a lot of stress in holding clients, the workload, the complexity, and there's the sadness too, because a lot of clients have very sad lives, you know. Something I always say to some clients is, it is very difficult for me to even hear your story, let alone to have thought that you'd lived this story, you know, because people have some very, very sad stories just to tell. Yeah, so so that's, you know, part of the stress that comes with working with people, is the empathy and, you know, the sadness that goes. But also there's a lot of hope and joy too about what they can achieve and what they may move on to. And it's all about their choice, you know. They're not victims. It's about empowering people to move on and gain, you know, successful, happy lives. You know, and that's what we aim to give. You know. You develop deep bonds with people, because when you're moving through so many complex problems, you know, you really get to know people well. You have to be careful of dependence, but, you know, like, there's always that empathy, and you know, you move through perhaps developing needs and togetherness into independence. So it's like, you know, growing children and dealing with their problems and then getting them well and waving them goodbye. And you know, it's about moving people on. So yeah, there's a lot of happy moments, as well as sad ones as well. So it's a very complex and complicated field with all its ups and downs that really mirror life, actually, I think, you know, in our individual travels through life. It's a very interesting field. I mean, one thing, it's coming from a scientific background, you know, the latest developments in neurobiochemistry and just understanding how drugs affect our brains and then our emotions and feelings. So just the intellectual component of AOD is really, really interesting. And then you've got it multi-layered onto mental health issues, which you have to develop an understanding of. And, you know, so you're dealing with people in a very complex environment, complex problems. And so, yeah, it's really challenging and engaging and very stimulating work. Yeah.